Hi, everybody. Thank you very much for joining us. Today, we are going to be having another one of the next in our series in the Solver ACEIR seminar series, where Professor Damiano K. Manda and James B. Ochieng will be presenting and discussing research that examines fiscal policy on both inequality and poverty in Kenya, with a focus on gender and children, by applying an analytical framework developed by the Commitment to Equity, CEQ, Institute at Tulane University. We're very pleased to be joined by our two presenters online. Prof. Damiano K. Manda is head of ACEIR's research node in Kenya and an associate professor at the Department of Economics and Development Studies at the University of Nairobi. James Babu Ochieng is a social policy officer with UNICEF Kenya, where he contributes to analytical work on macro-fiscal policy, social protection, and public finance for children, with a focus on strengthening evidence-based policymaking and improving development outcomes for children. This is the usual hybrid seminar format, so we're going to have ask our two presenters to take it away, and then we'll hold questions until the end.
So thank you so much, and thank you for coming for this seminar. Here we are going to present highlights on the report on poverty and distributional impacts of fiscal policy in Kenya, which uses a CEQ assessment approach. And this extends the analysis to gender and children. So what I'm going to do is to present the first part on CEQ, the overall research, then CEQ on gender. And then I'll allow my friend James to present a CEQ for children, but at some point we will interact on the methodology. So having said that, before we start, I just want to mention that of course this is the outline. So we are going to talk about CEQ studies in Kenya. And before we come back to this main study. So previously we have had two CEQ studies on Kenya. One was done by KIPPRA and Lange, who are from the World Bank, that is in 2018, using the Kenya Integrated Household Budget Survey 2015-2016. Then the second one was done by Kenya National Bureau of Statistics and University of Nairobi, which is the ACEIR node. That is 2022, and it was also using the same data set, although the two differ in slightly a number of ways. Of course, we used the data set that had been set up by the KIPPRA and Lange, but then we extended the study to include a few things. First, the second study takes into account welfare effect of excise duty. That is on mobile phones, LPG gas, that is liquid petroleum gas, kerosene, and soda and water, which was not taken into account in the study by KIPPRA. And then we also look at marginal effects. Yes, and then also we carried out simulations of changes in specific government transfers to assess their effects on either scaling it to reach out on a larger population, and also scaling or increasing cash received to see their impact on poverty and inequality. So those were the earlier studies. And now, of course, these earlier studies, especially the one for 2020, the first one was done by World Bank. The second one was, we did it, but it was sponsored by AFDB. And it was a collaboration between Kenya National Bureau of Statistics, University of Nairobi, and also the CEQ Institute, where we had Professor Stephen, who was with us, but we also collaborated with the under debit from the AFTB on that. Now the third study, which is the one we are going to present, which is poverty and distributional impact of fiscal policy in Kenya. This was done by a team of researchers from the World Bank, Kenya National Bureau of Statistics, UNICEF, ACEIR University of Nairobi, and KIPPRA. The team was slightly big, but if you have, I think you can access, we have an online version. If you access that, you will see the team that worked on this. So we had a core team and a larger team. And the core team comprised of the team that really worked on the report. Then the larger team supported us in terms of collecting administrative data and also looking at the document and also giving comments. But there was also training on CEQ, which took place concurrently with the writing. And this mainly involved training various participants from Kenya National Bureau of Statistics, KIPPRA, University of Nairobi, government ministries, which I have already mentioned here. And so this report goes beyond what was done in the first two reports, extending it to regions and gender and also children. So by way of introduction, we know that Kenya's long-term plan, that is Vision 2030, aims for inclusive growth and also improved standards of living for all citizens. So over the period of this long-term plan, Kenya has experienced significant economic progress. That is, and in that manner, it has achieved a lower middle income status and also expanded its financial inclusion and infrastructure. But then what remains is that we still face persistent poverty issues, especially in rural areas and also in ASAL counties, that is arid and semi-arid areas. Also, we experience high poverty in female-headed households and among children. So our if you look at the right-hand side, we show a picture of the overall poverty, and then the overall poverty for rural and urban areas. You can see that poverty still remains high. For example, in 2022, it was at 9.8 for the entire population and 42.9 for children. This is very close to what the World Bank classify, is very close to 40. No, I'm confusing. No, this is this still remains high, because if you convert this into the number of people who are under poverty, we get a substantial number of the population living in poverty. But then the children are affected even more. So that's what it shows. And the lower one shows that it is higher in rural areas than in urban areas. Don't know why it can't move. Okay. Inequality, we know it has declined over time, but it remains high. The figure on the right shows, tries to explain this. In 2022, for example, at the national level, inequality was 38.4. In urban areas, it was high. In rural areas, it was slightly lower. But at the national level, it's close to the 40%, which the World Bank suggests that if you hit that 40%, then you fall among the highly unequal. It shows that you have highly unequal distribution of income. So I was at that 8, we can easily slide into that range, although it is lower, but the good thing that it has been coming down, but there are fluctuations. And so what we do in this study, just to mention again, inequality is higher in urban than in rural areas. And also this combined with the issues that we are facing now, that is rising public debt, increased interest costs, and slow poverty reductions, which intensifies the need for more equitable fiscal space. So in this study, what we do is we try to see how then government uses fiscal policy to achieve reduction in poverty and inequality. So the broader objectives or the questions that we try to address is how to taxes and public spending redistribute income, and then what is the impact of fiscal policy on poverty rates, and then how to fiscal policy affect gender and child welfare. And then we try to look at what reforms could be done to enhance these outcomes. So that is in the presentations that we are going to make. We'll address these questions, both for at the national level, then by gender and also for children. The methodology used here is the commitment to equity framework. This framework addresses this analysis by coming up with income concepts. That is, there's income before taxation. And then when you apply, for example, direct tax, we have an income concept. And then thereafter, when we add, for example, cash transfers, we also have some income concept. And then when we add, when we subtract indirect taxes and add subsidies, again, we have an income concept. Then finally, when we look at, when we consider the in-kind transfers, which is expenditure mainly on health and education, we get another income concept. So at each income concept, what we do is we estimate both poverty and inequality, and then look at how, when you apply, for example, income, how does it affect, when we apply, for example, direct tax, how does it affect inequality and also poverty. So in our case, what we use is household consumption expenditure as a measure for income because of the higher proportion of informality in Kenya and also self-employment. So we use that, and that was picked directly from what the Kenya National Bureau of Statistics estimated. And then from there, we work forward and backwards to estimate the other income concepts. So our pre-fiscal income here is the market income plus pension. And then we apply direct taxes to get net income. And then we add direct transfers, cash transfers to get disposable income. Although we started with disposable income, if you have that disposable income, which is the household expenditure, which we take as our disposable income, we add cash transfers to get to net income from disposable income, or just take market income plus pensions minus direct tax to get the net income. Then to move from disposable income, we net out indirect taxes, and then there are also subsidies there we include to reach to the consumable income, and then from consumable income to final income, we add the indirect, the in-kind cash transfers. So a little bit details of this, which taxes and transfer do we include in the analysis? Here we include the personal income tax, mainly the payee, which is a larger proportion of that. And then we have the social insurance contribution. And then for the indirect tax, we have value-added tax and excise tax. Then for expenditures, on the expenditure side, we have direct transfers, which include hunger safety net program, old persons cash transfer for orphans and vulnerable children, and then persons with severe disability cash transfers. Then we have the nutritional improvement through cash and health and education, which is the niche also is considered. The indirect subsidies here, we include fuel subsidy and fertilizer subsidy. And then for the in-kind benefits, we have expenditure on education, which is at the pre-primary level, primary, secondary, and tertiary level. And then health, that is inpatient and outpatient. I'll talk a little bit about what we did for each. So here I've already mentioned that the household disposable income is assumed to be equal to the household expenditure. This is the expenditure that was calculated by the Kenya National Bureau of Statistics. And we note that this is a better, it better captures income because of the high degree of informality and self-employment. And so from this, we construct the other incomes as guided in the earlier diagram. Our pre-fiscal income here is the market income plus pensions, and then our net income is just disposable income plus cash transfer. Then for consumable income, we have the indirect subsidies, which are added, while indirect taxes are subtracted. But here we consider both, we look at both the two effects, the direct and indirect effects of both VAT and excise tax. We also look at the indirect and direct taxes of subsidies. So in our analysis, we look at both of them. Of course, the conversion here is done by input-output matrix. We also calculate the in-kind transfer for education and health. Of course, for education, what we do is we take the expenditure on every level of education divided by the number of learners in public schools. And then for for health, because of data issues, because health is now a devolved function at the county level, and we do not have yet good data from those units. So what we did is we used the unit cost used in previous CEQ studies, and you just adjusted it to using the consumer price index to get the prices as at 2022. So that's what we did. Probably something else I should mention here. Of course, for VAT is only applied only on formally purchased goods, because we believe that if you are in the informal sector, then you do not pay VAT. But the data set did not give us information on where the commodity was purchased, and so we simulated this using KIPPRA 2015-2016. We used that information to simulate to find or to get an approximation of where the goods were purchased. So I needed to mention that. Of course, the CEQ method has several advantages and also limitations. So the advantages here is that it assesses the effect of tax and expenditure policies on both inequality and poverty. So for each level of income concept, you can estimate inequality, and you can also estimate poverty, and use this to carry out the comparisons. Then using this method is easier for comparisons, because the studies have been done in several countries using the same method. And so the results may be easier to compare because the method is similar. The limitations: this is an accounting approach, and therefore it doesn't look at behavioral responses or even general equilibrium or intertemporal effects. And so we can look at the results that we get here as short-run effects. It does not also cover all taxes. As I mentioned, if you look at, as I mentioned earlier, we do not look at, for example, corporate income tax because of the difficulty of linking this tax to the household level, so it is not included. And also we do not include import taxes because of the same problem, and also the issue of expenditure on infrastructure. Then at some point we use the survey, and as we know that the survey may not cover top income households, because probably getting some of the top income earners to be interviewed could be a problem. So, but this is a limitation of some of the surveys that we have. And then another limitation is that sometimes the analysis, for example, when we are looking at gender, we may need to do kind of stratification, but then we find that we may find that some stratification may not be representative for some of the programs or groups. Then extension to gender, the same assessment is done, but now what we need to do here is to come up with some way of defining gender. So, but here gender can be defined using household types or even gender of the individual. So when we use the gender of the individual, maybe you would be focusing on the expenditure side only. We are not looking at taxes. For example, you want to look at the impact of spending on education and health on gender, then you can use the last definition of gender, that is gender of the individual. But here, we are considering both the impact of taxation and expenditure. So our classification is tied around the household type, gender of the household. And so studies focusing on the impact of tax and transfers rely on approximations and therefore define gender in terms of household headship by share of gender income contribution within the household, gender care responsibility in the households, and also the number of adult males or females in a household, among others. What we use in our analysis is what is painted in black. So because in Kenya, gender, most of our analysis before has used gender of the household head, so we included that. But we also include gender contribution in terms of income, and this income is employment income. So if we have women within a household contribute 60% of the income in that household, then we look at that as a female household. Or if male contributes 60% of their employment income in that household, then we look at that household as a male type household. Then we go further to subdivide it by looking at the care issue that we mentioned. So we look at households with children and elderly. This could be households where women contribute 60% of the income, but also they have children and elderly. And also those that just they contribute more, but they have children only, there are no elderly persons in that house, or those households without children, but then we have elderly, and those where there are no children and there are no elderly, but then women and men contribute 60% in those households. So we categorize our households in this manner. On the right-hand side, we have the proportion of those households in our sample. Some border that level where we are saying that it may not be representative, but we include them here because we look at the sample size or the number of individuals the number of households that are included, even though it is small. So we include it in the analysis. So I'll leave. I think I can allow James to present this extension to children before we come to the findings. So James.
Yeah, thanks a lot, Prof, for the background. So I think maybe majority might be asking, so why children? So if you look at even the proportion of children in Kenya, it's a significant number. Around 42% of the entire population is composed of children. So that translates to around 22 million individuals. So we believe that fiscal policy in general affects children differently. And for that reason, it's important to determine how their welfare changes when government implements various policies in the form of taxation and spending. So just to mention that in terms of the design and the structure of the CEQ that Prof has just presented, and the CEQ for C, that is the extension that covers children, the design is the same and most of the interventions are also similar. So some of the slight differences that we observe here is that when it comes to the sample size, the CEQ for C will restrict the sample to how a child is defined in Kenya, and that is below the age of 18 years. And then we factor in a very important element, that is multidimensional child poverty. And we believe that this is a very important tool that policymakers should actually interact with, such that as new populations of children that are vulnerable are identified, then the government can come up with alternative measures to reach them through various fiscal interventions. Then the other difference is that when it comes to the fiscal interventions, of course, majority are similar, but we restrict it to what we call the child budget. So the child budget here is just the fiscal interventions that have a direct impact to a large extent on children. So looking at even taxes, for example, the assumption here is that a child that lives in a household that maybe pay taxes in the form of maybe pay, also inherit in quotes such kind of taxes. And then the cash transfers that all the social protection programs that Prof has highlighted, any child that lives in a household that benefits from those programs will indirectly benefit from the same. But of course, we also have some programs that target directly on children, like the cash transfers to orphans and vulnerable children, and the nature program that targets children in Kenya below the age of 3 years. So that is one particular difference. Then when it comes to education expenditure, for example, we limit to the spending on pre-primary. That is what elsewhere people call it the nursery school level. Then we have primary school level and secondary school level. So that is the main distinction between the CEQ baseline that Prof has presented and CEQ for C that I'll later on present. I think, Prof, that is just the brief methodology in terms of maybe just to highlight on how we constructed on the multidimensional child poverty. We used the demographic health survey for 2022 to derive the anthropometric measures that we then linked to the KCHS, that is the Kenya Continuous Household Survey, using the wealth indices. So I think later on I'll highlight on the findings once Prof has finalized on the main presentation. Thank you. Over, Prof.
So thank you. So this is the data set that is here, the Kenya Continuous Household Budget Survey 2022, complemented with the administrative data on tax expenditure subsidies. And most of these were provided by colleagues from the ministry, National Treasury, and all that, and Kenya KRA. So we move to key findings. We find that the fiscal system narrows the income gaps. That is, it reduces inequality. And you can see seems like I cannot use my mouse to show. So if you look at the graph, inequality at the pre-fiscal income, that is before taxation, is 40.1. And then when you apply direct tax, it reduces inequality to that 8.3. Then disposable from net income to disposable income, which means we have added cash transfers. It reduces slightly. It's now 38. Then it goes further to when you apply in indirect taxes and subsidies to 37.7, and then final income to 35.5. So from here we see that it reduces, the Gini index falls by 4.6 percentage points due to applying both taxes and transfers. And so it reduces inequality. But we also find that inequality is higher in urban and rural areas, although the general trend remains that it is higher, but then when you apply this, it reduces, but in varying degrees. We also find that we find that inequality is higher in urban and rural areas compared to rural and it's urban and non-rural areas compared to rural and rural areas. And there is greater reduction in inequality observed in urban and non-rural areas. But when it comes to poverty, poverty increases when you apply the fiscal interventions. It increases poverty. For example, before taxation, poverty is at 9.6, and after taxation, poverty is 42.3. Here we do not go up to the final income because of obvious reasons that when you look at poverty, we look at cash at hand. And so we mainly go up to consumable income because the in-kind transfers do not translate to cash at hand, and therefore they are not included in the poverty calculations. So here it increases poverty by 2.7 percentage points. And this is mainly due to the fact that the burden of direct and indirect tax outweigh the benefits of the cash transfers and subsidies, especially for the lower income households. And so we find that poverty increases. We also find that when you apply this, poverty increases more in urban than in urban and rural areas than in the other areas. This is just international comparison where Kenya is highlighted in red. As you can see, using the 2022 Kenya Continuous Household Budget Survey, it reduces inequality. The left panel facing the screen, the left panel is for inequality and the right panel is for poverty. And so we can see that Kenya's fiscal system reduces inequality by 4.6, which is lower than for some of the countries in the middle income countries, although it's higher than countries in the low income. But then this shows that there is room that Kenya can still use this fiscal policy to improve in reducing inequality. But when it comes to poverty, we can see it increases poverty by 2.7. For some countries, fiscal policy increases poverty, but we can see that for others, it reduces poverty. In fact, when from the last presentation where Ghana presented its finding, it indicated that now they can use the fiscal policy to reduce both inequality and poverty. An indication that Kenya can still use the fiscal system to reduce both poverty and inequality. But as of now, as it is, the fiscal system increases poverty. In terms of who benefits from this system, which households benefit, So from here, we can see, from this diagram, we can see that the low income households benefit more. If you look at the graph, the net total position and the net cash position. So you can see for the first around 8 deciles, the net total position is above 0, which means that those households generally benefit from the system. This net total position includes, it is the net cash position plus the in-kind transfers or plus the transfers. So from this graph, we can see the poorer households benefit, but the main benefit comes from education, which is highlighted in blue. And for example, for the first decile, there is also the direct transfers, cash transfers benefit. It benefits from direct cash transfers, an indication that these cash transfers are well targeted to the poor households, and it reduces even as we move to the higher income level. So from the lowest is the lower income, and as we move to the right, that is the high income. Then the topmost decile of rich individuals contribute net payers. That is, they contribute more to taxation than they benefit, because you can see the net total position is below the 0 level. So they are net payers in terms of, if you look at what they benefit in terms of the transfers and what they contribute, they are net payers. Then we look at which taxes here are progressive, and we see that personal income tax is actually here the most progressive of the taxes is personal income tax, but we also see that social insurance contributions here, they are progressive. Here, if you take the net effect of excise tax and VAT, we find that they are progressive, but not as much as the personal income tax. But again, this is just in line with the way the tax is designed, such that the poor pay or the poor fall in a lower tax band than compared to those the rich who pay who fall in a higher tax band. In terms of expenditure, the cash transfers, we have the initial, which is highly progressive, followed by cash transfer for the people with severe disabilities. So most of the cash transfers are progressive, but the one that is less progressive is the tertiary education, which is less progressive here. And the reason could be that there are we can look at it as there are some kind of structural restrictions that probably do not allow the poor to access education at this level, because most of them tend to go to lower, most of their basic education could be in schools which do not provide quality education, and therefore most of them do not find themselves in the university where they could benefit as much. Findings on gender. Here again, we find that fiscal policy reduces gender income gaps. That is, it narrows the average income gap. If you look at the upper panel, no, that one does not. This is somewhere in the main report. There we have a table which shows that if you look at the difference in income between male type and female type households before taxation, and then after, you will find that the income is lower at that level after taxation or after fiscal policy has been applied. So it narrows the average gender income gap. And here we know that in-kind transfers, especially education, drives the reduction in inequality, followed by direct taxes and cash transfers. Also looking at now inequality in terms of the measurements that we have, we see that in terms of Gini points, here we compare the inequality between male type households of the same for example, for male female households, we compare that for male and female at pre-income level and then at the final income level, and we find that so the red one is for the final income and the blue one is at the pre-income before. So for households where the red one is shorter than the blue one, it shows that inequality declined between male and female households, although there are some where it increases, like especially the second last, and also the one where we have males and female contributing 60%, but and they only have children, so that there it does not it rather increases, which means if we do not look at gender, disaggregate gender in terms of bargaining power, for example, and also in terms of looking at their commitment in terms of caregiving, we may miss out on some of these differences among the households. In terms of poverty, we can see that it generally fiscal policy will increase poverty in both male and female households, but then it increases poverty much more in the increase in poverty is much more in male type households, and that's why if we compare now poverty before taxation and after taxation, that is at the consumable income, we see that there is a decrease, but that decrease is not because poverty is reducing for both households. It is because fiscal policy is worsening poverty, but that worsening is much more in male households, and therefore that tries to reduce that gap. Then other analysis shows that female-headed households benefit more, with 9%, 9 deciles being net receivers, and only the last decile being the net contributors, the net payers. This is if you compare with the male, where only 8 are the net receivers, and the last 2 are net payers. And also, where households where women earn most of the income are net beneficiaries, but male majority income households are net payers. Those are some of the differences that arise from this analysis. And so we know that households with dependent children, that is children and elderly, and gender disparities narrow less or even widen, indicating that caregiving patterns limit the redistributive effect of fiscal policy. And so those are the findings we have for gender, key findings we have for gender and the overall CEQ analysis. So I'll let me.
Yes,
James,
Prof, I'm already
James,
sharing. I don't know whether you're able to see.
Yes,
I'm
able to see, so you can proceed.
Yes, yeah. So once again, thanks. So I'll quickly highlight on the key findings for children. And just like I mentioned before, the government of Kenya has made various commitments to children through education, health, social protection programs. And these particular commitments are financed by taxes. So our main intention here for including children is that after the government has provided these public services that are financed by taxes, do we have our children better off as a result? And one of the key findings that we're able to reach is that fortunately, our fiscal system succeeds in reducing child inequality as measured by the Gini coefficient. And you can see that the Gini index at the final income reduces by 5.4 Gini points. And if you look at how this plays out, the proportion that comes from direct taxes and transfers and the proportion that comes from in-kind transfers are nearly half. However, the proportion that comes from in-kind transfers for children relative to the overall population, the in-kind transfers drives more the reduction in inequality compared to the overall population. Now, this is expected because children compared to others are more likely to consume public services in the form of health and education. So that was one key finding. However, on the other hand, we were able to conclude that our fiscal system impoverishes our children. And as you can see how the various fiscal interventions play out from at different income concepts, you can see that the proportion that comes from direct taxes and the transfers is not as huge as compared to the poverty increasing effect of indirect taxes in the form of VAT. So you see that overall poverty increases by around 3.1 percentage points for children. And the main driver here is the VAT or indirect taxes that by design or by default disproportionately affect the poor households. So yes, our direct transfers or the cash transfers, they have that ability to reduce poverty, but the poverty increasing effect of indirect taxes outweighs the poverty, outweighs this effect, such that the net or the overall impact is that we end up with poverty increasing at the consumable income for children and even the overall population. Then just looking at the progressivity and the proporedness of these interventions, I think Prof already mentioned that to a large extent, most of our in-kind and in-kind transfers and the social protection programs, they are generally progressive. But we see a situation where if you factor in multidimensional poverty, child poverty, and just from the definition of multidimensional poverty is all about deprivations. If you look at that in education, you can see that overall, what we were able to find is that the multidimensionally poor children in Kenya are around 59%, and the other 40.5% are not multidimensionally poor. But you can see that at the lower levels of education, the non-multidimensionally poor households or children capture most of the benefits compared to the better off, compared to the worse off children. But that one changes as you move towards the second education, where 62% of the benefits go to the multidimensionally poor children. And that is partly because of some of the interventions that the government has put in place. One of them is a free day second education. And we also observe that at that particular level, some households, better off households, are likely to send their children to private schools. And then looking at the other side for health, we see the same pattern. And this is typically what multidimensional child poverty actually is explained. So for the inpatient child services, health services versus the outpatient, you can see more or less the same pattern. Children from better off households capture most of the benefits. Although health is a universal service by Kenyan context and the way it's expected, so it means that there are certain barriers that these particular children face and they're not able to access these particular services. So in simple terms, these particular children are poor because they're not able to access these health services or education services. And they'll remain poor because they are deprived. Then just looking at the cash transfers, you see that overall they are progressive. And the nature program that Prof mentioned is a program that was brought in Kenya to tackle malnutrition. And it rides on the 4 nutrition national safety net programs, the 4 that are listed there. And one condition that one needs to meet is that you must have been enrolled in either one of these programs. And that's why you can see that its targeting is better than all these other programs. So up to nearly 85% of the nature benefits reaches the multidimensionally poor households. But of course, even others, we can see that there is general better targeting in as much as some requires some reforms, and I think some of them have already been initiated, like the cash transfer to the OVC. There are some reforms that are already in place to rectify that. Then, yes, we were able to conduct a series of policy simulations just to determine which are the most effective instruments when it comes to addressing the overall welfare. And we were able to test between cash transfers or direct transfers versus subsidies. And we were able to conclude that direct transfers are more effective in reducing poverty and inequality compared to subsidies. But just to highlight one of the examples here is that fertilizer subsidy, for example, if you eliminate fertilizer subsidy from the fiscal system, what particular effect does it have on the child welfare, for example? So we were able to determine that eliminating fertilizer subsidy from the system only increases poverty, child poverty, by 0.1 percentage points, but inequality actually remained unchanged. So if the overall objective is just child welfare, if that is the reason for having fertilizer subsidy in our Kenyan system, then we can effectively conclude that it is a weak instrument and we can do away with it, or such kind of the savings that come from it can be redirected to cash transfers. Then lastly, I know time is already fast spent. So what are some of the policy recommendations that we were able to come up with just to share with the government? Is that, yes, you're able to see that direct transfers are very, very effective in terms of reducing poverty compared to subsidies that in most cases are not well targeted. So that is an area that the government needs to expand. And then just applying gender lens, as already presented by Prof, is one way that we can also address gender inequality. And then for children, we are able to see that to address poverty, we can expand our cash transfers that are currently a bit limited. Most of the households that are poor are not covered within our social protection systems. And of course, the barriers that we saw that limits the ability to benefit more from education and health services can also be eliminated so that they can capture most of the benefits. And then, yes, we can conclude that we can do away with those inefficient subsidies in the form of fertilizers and fuel, and redirect those to more effective tools like cash transfers. And then lastly, just combining fiscal policy measures like that allows for more inclusive growth is something that Kenya can also explore for the overall welfare of the population. So I think I want to end it there, and thanks a lot to ACEIR for organizing this particular platform for us. I know I've been joined by a number of my colleagues. Later on, maybe if they would want maybe to come in. I know my chief also joined Dr. Anna Gabriela and other colleagues. Thanks a lot.
Thank you so much, Prof. and James. We are at the 2 o'clock South Africa time, which is the scheduled end, but it would be great to have a little bit of questions and answers just so people can take advantage of being here to hear about the work. I can go with a question. And I was very struck by the results because I've only really worked with the CEQ analysis in South Africa, and it was quite surprising to me to see a context where you actually have an increase in poverty from the fiscal redistribution. Then I saw it was evident in other countries, mainly low-income countries. And so I was wondering, what is the real driver of this? Is that about that, people at the bottom of the distribution are kind of informal and therefore not visible to the state, and so cash transfers, etc., can't get to them? Or what is the kind of structural feature that means in Kenya, but also more generally in low-income countries, of which Kenya is not, that you have that fiscal policy can increase poverty? I was really struck by that. So that would be my question.
Thanks for that question. Yeah, quite in a number of countries, as I showed in that table, you see that generally the fiscal policy will lower inequality, but when it comes to poverty, it increases. In South Africa, actually uses fiscal policy to reduce both. And the other country that now has joined that is Ghana. From the recent estimates, I think, if I followed the last presentation well, I think they have managed to reverse so that now they can use fiscal policy to reduce both poverty and inequality. In Kenya, I think one of the things that could be leading to this is that, yes, we have cash transfers, but the scale is small. It does not reach quite a number of people affected, and therefore, although it reduces poverty, but then the effect of taxation generally outweighs that effect. So one thing is the scale of the transfers. It reaches a small proportion of the people who require it. That is one. But also probably we could, another thing is that we could relook at our taxation system, and especially the indirect taxes, especially VAT. Probably look at the items which are consumed by the poor most, and probably do away with VAT on that, and also probably looking at the lower income group and probably adjusting the kind of income tax that we impose there, because we start with a tax band of 10%, Then we jump from 10 to 25. Probably relooking at that could also help in terms of using fiscal policy to help reduce poverty. So that's what I think the government could do. So thank you so much.
Thank you very much for that. There was a question from, I'm sorry, unless James, unless you wanted to come in on that as well. There was a question from Prof. Murray Labrand asking which, I mean, and you spoke to this partly now, but perhaps there are other related things, which is which key interventions emerge to break the cycle of intergenerational inequality and poverty from your interesting extension to children. So yeah, I guess that probably is more framed towards James. But either of you should please let us know what you think.
Okay, so you asked about the key interventions that are addressing inequality in Kenya, or if I think you're a bit fast.
Sorry, yeah. So which key interventions emerge to break the cycle of intergenerational inequality and poverty from the extension to children analysis that you did?
All right, yes. I think we were able to witness some fiscal policy conundrum. So on one side, we were able to see that fiscal policy succeeds in reducing inequality, but on the other hand, it leaves our children poorer. So looking at some of the measures that the government has already put in place, we have free primary education and free day secondary education. But as you saw from the findings, I think, yes, our in-kind transfers are already doing well in terms of reducing inequality. And this can further be reinforced by expanding the scale of direct cash transfers, which also contribute to reduction in inequality, as you saw from those particular interventions, and also poverty reduction. So on one hand, we can have a situation where, yes, we can have some of the taxes, yes, but how do we compensate for the poverty increasing effect that we see from VAT, for example? By expanding the scope of the coverage, I think is one measure that can break the cycle of poverty. And just looking at the size, most of the cash transfers, they have been in place, but they have not been adjusted to the increasing cost of living. So at the end of it, you can be getting your cash transfers, yes, but once you go out there, you end up paying the VAT taxes, then effectively this cannot have a powerful effect on poverty. So the interventions that we consider here for inequality are just the education and health, just ensuring that they are more accessible and breaking the barriers that our children face. More so in the ASALs that we see more inequality in terms of access because of maybe the distance, travel cost, weak referral systems, and such kind of things. So just having a mix that, yes, the in-kind transfers are there, but how do we increase the transfers that we see have a direct impact on poverty, I think is the way to go. Thank you.
Great. Thank you so much, Prof and James, for your very fascinating presentations. And I think we're going to have to end things here because we are a bit over time. Thank you, everybody, for joining, both online and in person. For the people who are in Cape Town, next week we will be in our regular Salary seminar series. We will have Hannah Dawson from the University of Johannesburg talking about landlords and tenants in an informal Johannesburg settlement. Thank you very much to everybody joining online, and especially to our two presenters. Thank you. Bye-bye.
Thank you so much.
Bye. Yeah.